Hi everybody, this is Dr. Fuladian, and we're going to start chapter 12, the part that is related to some regional terms, as chapter 12 is regarding the surface anatomy, and the last parts of that is about cross-sectional anatomy. As we discussed before, and you can see that clearly in this picture, that the surface anatomy talks about the landmarks that we have over the surface of the body, and we use those landmarks, means the signs, the prominent part, the things that are obvious, and we can find them over the surface of most of the people. And from those ones, we can reach to the beneath, to the internal structure that are located under that, and we use those landmarks over the surface of the body to determine what's going on under that. So, continuing on that one, as we discussed before, repeating those ones, surface anatomy is the study of anatomical landmarks on the external parts of the human body, outside of the body. Knowledge of surface anatomy has practical application. So pay attention that surface anatomy is not about knowing the skin that is covering out of the body. Is about the surface of the body, and as we said, those landmarks that we have over the surface of the body. And the reason that we are doing that, because of the application and the usage of that they are include an understanding of those internal structure. Those understandings is critical during medical examination. That's the one that we are using by touching of the surface, listening through the surface, and all those ones. We get information regarding the interior part of the body. And an understanding is essential for both invasive and non-invasive laboratory procedures. Like, for example, you have a patient that have some breathing problem. You examine and you see that you have some fluid in the lung that makes breathing difficult. So sometimes you have to withdraw that fluid. You have to do some invasive procedures. And for those ones, for example, you want to put a chest tube if there is some problems in the breathing, for example. And all those ones, you are using the landmark over the surface. Like, for example, the scapula bone on the back. It has some landmarks, this corner, that corner, and those ones. And those are very obvious, can be palpated and be touched over every single person. And from those ones, you know which level of the lung is located in this area. Is this one safe to put a needle inside, to put a tube inside, or we go 2 ribs lower and put a tube inside, and all those ones? These are all indications that they are using from the surface to reach into the body safely. Estimating the location of body part, as we said, knowing the palpation point, all those ones, right? So these are some examples of the application. So for the surface anatomy, what we are using is a regional approach. The surface anatomy is best studied during a regional approach based on anatomical region. And that's why I chose this chapter 12 to talk about this one, as we have started to know about the anatomical regions. So on the surface anatomy, we are going region by region for the head and neck, thorax, abdomen. For the upper limb, that includes shoulder, arm, it's repeated on here, forearm, wrist, and hands. And for the lower limb, that includes pelvis, thigh, leg, ankle, and foot, right? So we go over these areas one by one. Orientational term. So orientational term is referring to the terms that we are using, that mostly about the positions of one part of the body or the whole body. When we're talking about the whole body, we have a term, we call it anatomical position. And that's the basic term that you need to know to start learning anatomy, as it's talking about in which position of the body. We call it as a standard position that we are using in anatomy. First, let's see what is anatomical position. For the anatomical position, if I had enough room to show you when I'm standing, you would see me in this position, that standing on the feet, face straight forward, the hands are next to the body, not very far, and the palms of the hands are looking forward too, and the soles of the feet are completely on the ground. Right? As I said, the important thing is that the face is looking forward, the eyes are looking forward. Right? So this is the anatomical position. This is the situation that we call it an anatomical position, and whenever we are referring to the anatomical position, we're referring to such a position. Why do we need to define an anatomical position? Just again emphasizing that as we are discussing over the discussions about all the things that we are going to talk about now and later to the end of the semester, as we are not in the classroom, I ask you some questions, and although you are not right next to me, I'm not right next to you to hear your answer, you can just pause the video and think about the questions, or even rewind that and listen to that again if you didn't get it, and think about it and answer it to yourself, right? And later when I continue and give you the answers, you can compare that. How much did you get? Is there any other questions coming out of that? And all those ones. In other words, interact with the video, with the PowerPoints. Be active in your learning. That's the way that you will learn the best. So again, the question is that why do we need to define the anatomical position? What's the use of that, right? We use anatomical position as a standard so that when we are going to talk about the body, we have one standard that everybody knows in which position of the body we are talking about, right? Imagine one example of having such a term and having such a definition so that everybody knows about that standard definition. The patient is lying down on a surgery bed, right? You want to refer to one part of the body. You want to say that the part that is above the other part, for example. You're naming each one, right? So the patient might be lying down, the face up, or if you're doing the surgery on the back, the patient might be lying down, face down, right? So we're not gonna change the term that we are using, right? When we are comparing two parts of the body, we use a specific term. And the important thing is that no matter in which position the body is located right now, we are considering the body as this figure that you see in front of you, standing on the feet, arms next to the body, face forward, palms forward, soles of the feet on the ground. So in this position, head is always on the top of the neck. Neck is always on the top of this center of the body that we call it trunk, right? Upper extremities are to the sides compared to the center of the body, right? So all these ones helps us to talk about different parts of the body, no matter in which position the person is located right now. We always consider that in a standard position, but we call it anatomical position. So I hope this makes it clear and there will be no confusion about that. So we have two variations of the anatomical positions. When the person is lying down and face up, we call it a supine. And when the person is lying down and face down, we call it a prone position. Like for example, when we go to the cadaver room, you see that most of the cadavers are supine in supine position. One of them might be in the prone position, that you see the back of the cadaver instead of the belly of the cadaver, right? So these are the situations that again, all the other things are the anatomical position, but that person is not standing. And pay attention, supine and prone are as if that person has been in the anatomical position, now is lying down. But we all now know that lying down means that that's not in the standard anatomical position anymore. Now, going over the regions of the body. We said that for the surface anatomy, we divide the body to 5 regions. We start with the head and neck. And this is a combination of the chapter 12, that you have the regions of the body, according naming of the 5 different regions of the body and all the structures, not all, most of the structure that we have over there, at least main parts over there, combining with the terms that we had with the chapter 1, so that you can learn them better, right? So these are all just a review of all you had in the lab, handouts and all those ones, and you're going to review them over the surface of the body, over the models that we had in the lab, over the picture of the chapter to learn, and you're going to learn all these ones. So as we said, cephalon is related to the head, cephalic is adjective to that, and the area is head. Front, that is a name, frontal is adjective for that and refers to the forehead. Orbit is related to the bony eye socket, that the eye is located to that, and orbital is adjective for whatever structure you have inside that orbit. Nose, that we all know, nasal is adjective related to the nose. Buccal, that is the cheek, and buccal is adjective. Oris is referred to the mouth, and oral is adjective. Chin is called mentis, and the mental is adjective for that, and the ear is called otic area, otic is adjective for that. And the occiput is the back of the head or the base of the skull. So this is the cephalon or the head, and then below that you have the neck, that we call it cervices, and cervical is the adjective. So again, this is the same areas, head, cephalic, and the neck, cervical. And some other structure might be discussed here. Brain case, that the area that if you see that here, this is the area of the head that the brain is located. Another word, brain case. We call it cranium. And whatever is related to that is called cranial. So sometimes you may see that we call it cranial, the same way that means toward the head, toward the brain, right? We talk about the ear, that is otic, face, facial, forehead, frontal, temple, this area, temporal, eye, orbital, cheek, buccal, nose, nasal, mouth, oral, tongue is lingual. Whatever is related to tongue is called lingual, like lingual nerve, lingual artery, and all those ones. And we have chin as mental, as we discussed. So over what you are going to do, you're going over the pictures that you have over the chapter 12, and I will put those ones in the PowerPoints of chapter 12, and also I will put some for the lab also. And you defining all the terms that you have here, find those ones. As you see, each picture has lots of structures over there. You don't need to know all the ones that over the picture, but make sure that you are knowing like whatever has been mentioned over this slide has been written over the slides over there. And also pay attention that whatever you have on the study guide, also you need to know over the pictures, over the models and everything. So after head and neck, we go to the torso or trunk. That we said that the torso is the center of the body. If you put the head and neck, upper limb and lower limb away, what remains in the center is called torso or trunk. First go over the posterior part of that we call it dorsum. And the adjective for that is dorsal, that is the back area. On the back you have a scapula, that's the shoulder blade area, and then in the middle you have the vertebral area of the spinal cord. On the lower back area we have lumbus, the adjective for that is lumbar. That's like, for example, we call lumbar pain means low back pain, right? That's the area between the ribs and the hips. We call it lumbar. And sacrum or sacral, that the regions between the hips. Gluteus, the adjective is gluteal, is the vertebral rump. And the perineum, the adjective is perineal. That's region between the anus and the area that we have the external genital. So in the picture, regarding the back or dorsal, as you see here, you have the shoulder blade here. You see the lower tip of the shoulder blade here, and this is the rest of that here. Then you have the vertebral area in the middle here. You have the lower back or lumbar area in this area, and you have the hips or gluteal here, and you have the sacral area in this area, and the rear and down is perineal. The anterior part of the trunk or torso includes the chest area that is above the diaphragm, part of the torso that is above the diaphragm. You have the belly, that is the abdominal area before the diaphragm, and below the abdominal area we have the pelvic region that is below the hip area. This is the hip area, these two parts that you can touch it. You have a bone over there and you can find it. That's the area that the hip starts. So going over these three regions, thoracic area, abdominal area, and pelvic area. The name for the thorax is thoracis. Adjective for that is thoracic, the chest or thorax. We have a bone in the middle here that we call it the sternum. Later when you go to see all the bones, you will learn about that more, but just know the region that we call it the breastbone. The anatomical term for that is sternum, and sternal is adjective for that. The area of the armpit is called axilla, and the adjective for that is axillary, and the breast region is called the mama, and the adjective for that is mammary. So you see all these ones for the anterior of the thorax, the thoracis area, and the here is the posterior that we already talked about this one. For the anterior, you have the sternum area, the sternal area, as we use in our adjective. You have the mama here, you have the armpit here, and again, that's it. And for the abdomen, adjective for that is abdominal. The anterior body trunk region inferior to the ribs, and to be specific, inferior to the diaphragm. And the umbilicus, the adjective for that is umbilical, that's navel area. Then going over the pelvis, that is the area below the abdomen, but as we discussed before, there is no physical border between the abdomen and pelvis, therefore most of the time we call it abdominal pelvic area. We use both of them as an adjective because those are defining area. The whole area is called abdominal pelvic area. So pelvis, that's the name. Pelvic is the adjective for that, and the pelvis region in general, we call it pelvis and pelvic. Pubis is part of the pelvic area. The anterior part of the pelvis is called pubis, and the adjective for that is pubic. That's the genital region. That's the genitalia, external genitalia located on that. Inguinal, that is the area, groin area, or the crease between thigh and trunk, and the adjective for that is inguinal. So here you see the abdominal area here, and here you see the pelvic area before that. In this part you see the groin or inguinal, inguine, adjective for that inguinal, and the same here you see that one here. So for the upper limb, shoulder and arm, forearm, wrist, and hand. For this area, it starts with the area we call it acromion. When we go over the shoulder, we have a bone, we call it the scapula, and we see all these areas over those ones. Just get familiar with these terms that we have an area, we call it acromion. That's the points of the shoulder in this area that is side stance. Then we have the brachium. That's the arm area, whatever related to that is called brachial. Pay attention that brachium and brachial are different from the bronchial. Bronchial is related to lungs, bronchi, bronchus and bronchi. It has O in it, right? But brachium and brachial is related to the arm. Then we have antebrachium. Not here. That's this one. Antebrachium, and antebrachium means forearm, between the elbow and the wrist. We have another term, antecubitus and antecubital. That's the anterior surface of the elbow, and posterior surface, the elbow itself, is cubitus or olecranum, and we call it olecranal for the adjective. That's the posterior aspect of the elbow here, if you see that. And the carpus or carpal is the wrist area. The whole hand is called manus, and the manual is the adjective for that. Thumb itself is called pollex. The palm of the hand is called palm, and palmar is the adjective for that. And each finger is called digit, and digital is adjective for that. Like, for example, when we call it digital exam, it's not that digital as we know nowadays in the computer. It actually means digital exam with the fingers. And pay attention that in the Latin also digit is used for both fingers and toes, right? In spite of the English that we call finger for the hand, toes for the foot. In the Latin and in the anatomy also digit refers to both the same. So it might be regarding to the fingers or the toes. So again, in this picture you see the upper extremity or the forelimb. We call it forelimb because in the other animals that are on the forefeet, these are the fore part of the body, front of the body, right? So we call them forelimb. So shoulder is acromial area, armpit, axillary region, upper arm or arm, brachium. Lower arm and forearm is antebrachium, and the wrist is carpal. It's just showing again in the other picture. The entire hand is manus, body of the hand, front surface is palm, and pay attention that the back of the hand is called dorsum, dorsum of the hand. Means that in anatomical position, this is the front, palm is in the front, and the other side is on the back. That's the dorsum, right? So you see one indication of the anatomical position right there. We have fingers, we call them digits, including the thumb. So even thumb by itself, even thumb is called pollex specifically, still is a digit 2. So you see all those parts here, brachium, antebrachium, cubitus, antecubitus, and the other side cannot be seen very well here. You have the carpal area, pollex, and the digits, and you're looking at the dorsum of the hand. Again, you have all those areas, you can go over them and find those areas. And regarding the lower limb, you have the pelvis and thigh, leg, ankle, and foot. The first term that we have for the hip area, we call it coxal. That's the name, and the adjective for that is coxal. Like for example, when we go to the bones, you will see that we have a bone, we call it coxal, right? So you have the whole bone of the hip. The side of the pelvis and upper thigh, the area that the pelvis starts, you can touch it from the side and it goes down. Sorry, I haven't sneezed. Then we have femur or femoral. Femoral is adjective for that. That refers to the thigh area between the hip and knee. And we have a bone here, we call it femur. The whole region is called femoral area. And whatever we have here, you will see that we have some femoral muscles, femoral nerve, femoral artery, and all those ones. So refers to the area of the thigh. And then we have patella, and adjective patella, that's the anterior knee or kneecap region. We have popliteus, that is posterior or back of the knee. The adjective for that is popliteus. So popliteus is the opposite of the patella. Then we have the crus, that refers to the leg. Pay attention that we have to differentiate between the thigh, that's between the hip and the knee, and also differentiate thigh from the leg, that is from knee to the ankle. In lay language, we may just call the whole lower extremity as leg, and everybody may refer to that too. That's true, but in anatomy, leg refers only from knee to the ankle, and the term for that is crus, and the adjective is cruel. Then we have sural, and the adjective sural for the calf or posterior surface of the leg specifically. So the whole leg in this area between the knee and ankle is crus, and the posterior of the leg is sur. Like for example, you will see that we have a sural muscle, sural artery, all those. Then we have fibula, and the other term for that is also common, is called pronaul, is the side of the leg specifically. We have the term pes or pedal, that refers to the foot. We have tarsus, that is the ankle. So the term for the ankle is tarsus, and the tarsal is adjective for that. For example, when we say tarsal bone, means the bones that are forming the ankle. You will see that we have 7 bones that are making the ankle area, and every single one of them can be called the tarsal bone. So if you specifically later you will learn the name of every single one of them, you cannot, if you ask that what's the specific name of this bone, you cannot just say tarsal bone, because tarsal bone can be 6 other bones too, right? So the tarsal refers the whole area of the ankle. Calcaneus, that refers to the heel of the foot, the area that put the feet down over there. And calcaneal is an adjective for that. Later you will see that, for example, you have a tendon that you know the famous name for that, Achilles tendon, but in anatomical language we call it calcaneal tendon because it's attaching to the calcaneus, to the heel. Right? Again, here you see that we have digits for the toes, that we have the same naming as the fingers, and we have plantar, that's the sole of the feet, and plantar means whatever you have on the plantar, and We see that also for the grade 2 we have a specific name that we call it hallux, right? And again in this picture you see the whole things again. The thigh is femoral, front of the knee is patella, back of the knee is poplita, all lower leg is crus, crural region, front of the lower leg is shin, and the back of the lower leg is calf or sural region. And for the ankle we have tarsal heel. You see the whole ankle area here is ankle. Then you have the heel here that we call it calcaneus. The entire foot is called pedal or press. Sorry. Then in the middle you have some bones here, long bones, that the whole area is called metatarsal. Meta means between, right? So these are between the tarsal bones of the ankle that we have here and the digits that we have here, the toes here. Between these we have metatarsal. Here the same way for the hand, we will see that between the carpal area, that is the wrist, and the fingers that we have here in the middle, we have metacarpal area. Then bottom surface of the foot is the sole or the plantar surface, and this part is considered the back or dorsum of the foot here, right? And the toes, as we say, are digits, and the big toe specifically is hallux. So again, in these pictures, also you can see the thigh from the anterior view, and this one we can see from the lateral view, and also you see the gluteal region too. And here you see from the posterior view, as you see between the hip and the knee is called the thigh. You see from the posterior view that you're looking at the back of the knee. So this is a popliteal area. Like for example, you have kind of a depression here. We call it popliteal fossa. You will learn all these terms later. And here you see the front of the knee, that is the patella, the small bone that we have, and the whole area is called patella. You see the shin area, front of the leg, so the whole leg is between the knee and ankle. You see the shin on the front of the leg, and you see the soleus, that you have a muscle that you have in the sural area, on the back, or calf area, that's the back of the leg. And you see again all those parts, dorsum of the foot. You see the tendon that we call the calcaneal tendon, that is the Achilles tendon. You have the calcaneus here. You go and find all the other structure over all the pictures that you have. You will practice on them over the lab, over the torsos, and also you can start learning that over the surface of your body too. That's very helpful, that later you're going to go and find the structures beneath this area. You always start from the steps. So the next part is cross-sectional anatomy. What does it mean, cross-sectional anatomy? Cross-sectional anatomy simply refers to the way that we study body section by section. And as we discuss about the cross-sections in the chapter 1, you know that the cross-sections or the transverse sections or horizontal sections are the sections that we make parallel to the horizon, the horizontal line, right? So if we make some pictures to, for example, CAT scan or CT scan or MRI, some forms of the MRI in the cross-section way, if we cut them in the cross-section or transverse section or horizontal section, and we study them in this way, we call it cross-sectional anatomy. So cross-sectional views or cross-sectional anatomy are views that divide the body or tissue into the superior and inferior section. Yeah, like if it is a complete body, if you cross-section it, means that you cut it in a transverse section or cross-section. These are important for understanding radiological techniques, as I said, for example, CAT scan or CT scan, and also cross-sectional form of the MRI. Pay attention that MRI might be frontal, might be from the sagittal, there might be many other view, but one form might be cross-section. So the standard method of viewing radiological images. You need to know this part that when you looking at the cross-sectional view, like for example for the CAT scan, at least to know how you are looking at that, which part of the body are you looking at. When you have one part and then you cut it, are you looking at the lower part that has left over that part? Or you are looking on the upper part that has left on the upper, right? What do you think? The way that we are looking, we have a standard method so that everybody is using the same technique when looking at those images. We view images from the feet toward the head, from the inferior view. So you have cut a cross sections, you have cut a part of the body out imaginary. Like when you get a CAT scan, you divide parts of the body into small sections. You can follow them better to see every single detail. Instead of having a big lump here, you divide them to 10 parts, right? So that you can see every single detail in every one of them, right? So every one of them, when you look at that, it's as if that you had this one, imagine in front of you. If you have this one, you pull it up and looking from the inferior view to that. So you're looking at the inferior view of that section. In this aspect, the anterior part goes to the top. So the top of the image is actually on the anterior part of the body. The posterior part goes to the bottom. So that's the posterior part of the body that you see that in the lower part of the image. The right side of the body appears on the left side of the image and the reverse. The left side of the body appears on the right side of the image. And these are the things that you need to know how you. Like here, in this section, you see that you have cut a cross section here. You have a horizontal plane, transverse plane here. You cut this head area at the level of the eye here. Now, imagine you have pulled it up here in this area and you're looking at that in front of yourself. So in this view, you're looking, this area that you see, that's the inferior surface of that section. This part is the anterior part. As you see, you have the nose and the two eyes here. So these are the anterior of the head. And in this part, this is the posterior part of the head in that area. This left side of the image is the right side of the body, and right side of the image is left side of the body. Now in each one of these, I put a few sections here. Like that one was from the eye area. This is from the lip area. Then the next one is at the level of the shoulders. And the next one is at the level of the armpit that passes through the thoracic cavity. And this one is lower, that you have the liver, that's part of the abdomen. The abdomen has started here, right? And this is lower in the middle part of the abdomen, and this one goes at the level of the hip, right? So, sorry about that. So this one, on these areas, on the study guide, I just put some very simple structures over there so that you get used to that, how you're looking at these cross sections and how you see the parts of it. Like for example here you see in this hip area, you see this is the anterior part of the body, means this side, this is the posterior. On the posterior of the body you have the vertebra here, the bone of the backbone, right? And you have the bone of the hip here that goes all the way here. You see some muscles around that. You see some empty space that's actually insides of the intestine. There's air that you have inside of the intestine and all those ways. So feel free to go and search around, but you won't be asked about all these details to recognize. But the things that I have mentioned in the study guide, you need to find them and you need to recognize them over any of these pictures that I give you and I will ask you from the lectures. So here you see, like for example, at the level mid of the abdomen, you see the kidney. Again, this is anterior, this is posterior, this is the vertebra that you have here. You have kidney, one kidney here, one kidney here. And if I ask you which one is the right side, which one is the left side, now you know that you're looking from the inferior and you know that this is the right side of the body, this is the left side of the body, right? So this is the right kidney, this is the left kidney. And here again, you're looking from the inferior of the level of the upper part of the abdomen, and this is the liver, the whole part that you see here. And if I ask you, this is the right side of the liver or the left side, this part is the right side of the liver, and this part is the left side of the liver. And again, as you see the vertebra in this area, and going up in the thoracic area, you will see that you have the two lungs here in the two sides. You have one lung here, another lung here, and here in the center you see that you have the heart here in the area and the cavity of inside of the lung that we're going to talk about them later. Is in the shoulder area, the same you see the bones and all those other stuff, and this is the area that you can see the inside of the mouth. Again, as you know, you're looking from the inferior, therefore this is the inferior view, this is the top part here. So this is the maxilla or upper jaw here, and this is upper lip, right? And this is the area that you see the eye, and also you see the brain in the brain case of the brain. So these are all the things that you need to know from the cross-sectional anatomy. You can review these ones for yourself and also go over the study guide and all these things. Just wanted to emphasize that for your lecture exams, you need to know the PowerPoint, study guides, and these videos, whatever discussion we had on these videos, and so far you should have realized that it's not hard to manage those ones. You just have to put time and be precise and ask any question. Find the answer to any question you have and start gathering the things that you need from the beginning. Don't wait for the week of the exam to search that, oh, what do we need for the exam? For your lecture and for your lab. From the first day, I give you all the things, so put them together from the first day and just add to them and review them frequently as much as you can. Okay, so that was the end of chapter 12, and just ask me any question that you have in my office hours and in the lab. All right? Very good.